Oh, okay. So I've got a question for you. Are young people receiving access to rehabilitation facilities, to a clinical assistance, the same way they're given access to these drugs?
I believe that no, they're not getting as much access to these rehabilitation centers than they are getting to these drugs.
And why do you think that is so?
Because I think maybe at school, your friends, some of your friends have drugs and like it's easy supply for you. But if you to seek help, you have to like to seek help. You have to be vulnerable and ask for it mostly. And no one is in the position to ask for help because people are actually enjoying these drugs.
This is in a school setup.
Yes.
Okay, now let's go to a home setup. Can you not receive help or access to help there?
That would need your parents to pay attention to your behavior because you can't just go to them and be like, I'm doing drugs, I need help. Because usually people doing drugs don't want help. Some want, but not everyone wants help because some are enjoying the drugs because they help them relieve their stress, get them to do work or.
Madam, is that true? Do drugs really help you to relieve stress and make you work extra hard?
Yeah, to a certain extent they do, but the unfortunate thing about it is that it's a maladaptive coping skill.
Okay.
It's like when people are stressed up, they actually turn to drugs, thinking that they are going to have a solution. But
Oh.
unfortunately, it's a very short-term solution.
Okay, okay. So now, if we look at the example of drug users, really, the people who actually, even the terms that are used to define drugs, dululu, skunk, and all those funny other words, do you think really there's an example of a drug user who has actually made it in life? I'll take you.
I would ask you to repeat your question
My
again.
question is there an example that you can actually use of a person who uses drugs? Somebody who is a certain example in the community or anywhere?
Well, yes, there is. But yes, there is. There are some people who have really abused drugs and later on looked for help and later on did something successful with their lives. Like I, for example, I'm not sure of the name, but I think it's Tronderai or something.
Okay.
He grew up as a child who was addicted to drugs, right? But later on went on and looked for help. At some extent, this help come from our other friends because we are surrounded with good people. So these good people will influence us to get help. So right now, this man is a business accountant. He's very accountant, is very successful, and he has managed to come over this drugs and substance abuse.
Okay.
Yeah.
So now to the experts. Is the government of Zimbabwe doing enough? Is it really doing enough, being active to assist these young people in the fight against drugs?
At the moment, I think, when you've got a problem, often you have to start by trying to understand what the problem really is.
Okay.
And we've got what they call the Interministerial Drug Task Force.
Okay.
That has been put together to try and help remedy this problem. But before they can start to jump into situations and bust all sorts of things,
Yes,
they
yes.
need to really understand what's really going on and how can we intervene. So there is a lot of work being done behind the scenes.
Okay.
It's got 5 pillars, the task force.
Oh.
It's got what we call the drug supply reduction, which looks to reduce the drugs coming in.
Okay, okay.
Okay, so the supply reduction, when that is effective, it then stops all these illegal drugs coming in. And then we've got the demand reduction. Demand reduction is really about trying to help the young people understand the dangers of the drugs.
Oh.
And also, what is it that makes them vulnerable to these issues? Lack of confidence, self-esteem, the anxiety, the depression, all these things that are behind someone taking drugs. And then we then also have the treatment and rehabilitation. And this is where we normally come in. It's about, now that you're addicted, what can you do to get help? Now, I want to kind of highlight on the treatment and rehabilitation aspect. When someone is addicted to drugs, it's not just about locking them away and make sure they don't take drugs for 2 months or 3 months. There is actually two components to addiction. There is what we call the physical addiction. You're actually physically addicted to a substance. Okay? Your body now can't live without it, physically, all right? So you've got to drink the alcohol, you've got to smoke, whatever it is that you're addicted to. And then there is, the most important part is actually the psychological dependency.
Okay.
Now, the psychological dependency is the thing that pushes you to go for the drug.
Oh.
What's behind the motivation to go and look for the drug? The pain that you're feeling, whether physically or emotionally, the anxiety, whatever other issues mentally that are going on that are pushing you, that vulnerability. And then once we've addressed those two, we are likely to keep that person off substances. The mistake that most families make is they will take you to a place like Annex. You're locked up in there for 3 weeks, and then you've not been taking the substance. You come back out, but the psychological aspect has not been addressed, and vice versa. Other families focus mainly on the psychological side and don't address the physical addiction. So these two need to work together, and quite intensively as well.
Okay.
Lastly, there is the community integration. It's about trying to help our societies, people that we live with, understand this problem so that we don't have the stigma that is pushing a lot of these drug addicts from not coming for help. Because if I come to you and I say, I'm struggling, can you take me to, I don't know, what do I do? You might actually find people laughing at you, or they could actually make things worse for you. So
yes,
our communities, the people, need to understand what's really going on and how they can be supported.
Oh wow. Wow, that is quite informative. Now
Yes,
I'm going to
also
go
maybe
to you.
coming back to your question again on whether government is doing enough. I'm going to talk in terms of resources. I
Yes.
think we have got limitations there.
Really?
A lot still has to be done. You'll realize that at the moment, in as far as rehabilitation is concerned,
Yes.
we are talking of the psychiatric unit at
Yes.
Karenyatwa, that's Annex, and we are also talking of Harare Hospital, and then in Mashingo we are talking of Ngomahuru.
Okay.
So that alone is not enough. So which means a lot still has to be done in terms of, building rehabilitation centers.
Well, is it not?
Sorry, if I may just come in on that as well.
Okay.
That actually, we can't even say it's not enough, because it's actually not drug and alcohol services. So we actually don't have any. Government-wise, we don't have facilities for drugs and alcohol.
For really?
Yes, because Annex, Ngomahuru, a lot of those spaces are actually mental health facilities.
Such as
for-
Ngucheni and Blaaya.
Exactly, for psychiatric patients.
Oh, so there's
Now we are dealing with addiction.
ah.
Those are two different things. Yeah.
okay.
So if you put someone who's an addict, somebody who smokes,
Mm-hmm.
in with someone who's got a severe mental illness like schizophrenia,
Yes.
what are you doing to?
Okay, yeah.
It's actually quite difficult for both of them to coexist in that kind of space.
We get the picture. Now I'm gonna go to you with another question. As a mother, what can you do to reach out to your child? Teenage children have got this certain behavior whereby they lock themselves, their emotions, they lock their thoughts, they shut the parent out. And it's really hard for a parent to just reach through. And you've got work and you've got family issues that you need to be dealing with, and your child has just shut you out. Now, how do you reach and reach out to the child as a mother?
Okay, as a mother, you'd realize that nowadays you need to be very much loving and very much patient. Just like you've already said that children are shutting themselves out. You need to teach the truth in love, to reach out to the children, and maybe also to be able to monitor what they will be doing